Why should I use a needle for sampling in the periphery?
I always use the needle because the needle has several advantages. First, the literature, several papers in the literature, systematic review and meta-analysis demonstrated the better sensitivity of transbronchial needle aspiration in comparison to forceps biopsy. The reason is that the needle can penetrate into the nodule, into the lesion, even if the mucosal surface is not affected by the tumor, or the tumor is adjacent to the airways.
With the needle, with the use of the needle, I increase my probability that the sample will be representative and that I will have a diagnosis. So I never hesitate to use the needle in the lung periphery.
The second advantage is that the needle aspirate allows us to perform rapid on-site evaluation that is very useful for managing the transbronchial approach to peripheral pulmonary nodules.
I think that it is safe to use the needle because the two complications that we can have with the needle sampling are the same complications that we can have with the forceps biopsy, which are the pneumothorax and bleeding. But sometimes we don't have the option, we have to use the needle. So there are not more complications with the needle than with the forceps biopsy.
In observational studies, the risk of bleeding has tended to be low, perhaps a reflection of the small gauge of the TBNA needle, as well as the small vessel size. Nevertheless, it's important to use techniques to minimize the risk of bleeding, such as the use of radial EBUS to assess the vascularity of the target lesion, and also to ensure that we are using additional tools such as thoracoscopy to direct our needle in the correct path as well to minimize that risk. And of course, if there is bleeding, it's important to then use additional techniques such as being able to wedge the bronchoscope or even the guide sheath to be able to help to control the bleeding further.